What if a single vial of blood could reveal the deadliest common cancer long before symptoms strike? Pancreatic cancer can sneak up silently, and 9 out of 10 patients die within a year. Stay with me. We are diving into MICED, PAC-MANN, exosomal RNA panels, and exactly what high-risk individuals can do today. The reality is very sober. Pancreatic cancer carries the highest mortality of any major cancer. 5-year survival hovers around 8% in Australia and under 11% globally. Even our best blood markers, CA19-9, misses early diagnosis and spikes in benign conditions. Over 80% of tumors aren't found until they are inoperable, and metastatic patients with spread live just 2 to 6 months after diagnosis. That's why innovators are hunting for a better blood test. Imagine detecting cancer by decoding tiny exosomes in your blood, tiny particles. Inside them ride microRNAs unique to pancreatic tumors. In a multi-center trial of 1,000 people, this panel hit up to 97% sensitivity for stage 1-2 disease, far outperforming the CA19-9. These blood tests isolate the particles in the blood and flash a red flag. The technology sounds like science fiction, but it is. But it's still in clinical trials, not yet. Not yet in the routine laboratories. But it's coming. It gives us hope. Now enter Pac-Man. That sounds like a game. Pac-Man. It's a 45-minute test using magnetic sensors to measure abnormal enzymes that only cancer cells produce. It's promising. Early studies report about 85% accuracy, even for small, surgically removable tumors. It runs on standard lab equipment and costs a cent per sample and could slot into routine checkups. But right now, it is confined to research centers, but it's coming soon. Next, we have MICE, multi-cancer early detection, not MICE, but MCED. Imagine a single blood test that scans for dozens, not just one, but dozens of cancers, multi-cancer. That's also being tested. In one study, it flagged pancreatic cancer in 62% of stage 1 cases and 84% overall. Not perfect yet, but it's the closest we have to a universal screening tool. If we can drive costs down and reduce false signals. So here's the problem. None of these tests are approved for general screening because there can be false results, false positives. They are sensitive, but they are not that specific yet. So they can lead to unnecessary procedures, unnecessary worry, and they need large scale trials to prove that they actually save lives. So the question comes, will early detection translate into meaningful survival gains or just more uncertainty? So the real question for high risk individuals is, if you know you carry genetic mutations, specific ones, or you have 2 or more first degree relatives with pancreatic cancer, you already qualify as high risk, and there are surveillance protocols. They may not be routine, but you can ask for them. You can have endoscopic ultrasound and MRI every 6 to 12 months. CA19-9, which we mentioned earlier, can be still used, but with limitations. And then you can ask for referrals to clinical trials for these new tests. RNA, MICED, PAC-MANN, often at no cost. We stand on the brink of a screening revolution. Picture this, a future where routine blood tests can detect pancreatic cancer years before pain or weight loss. A world where surgery and cure are possible, not wishful thinking. This is the frontline at the moment, August 2025. If this gave you hope or sparked interest or questions, leave a comment. Hit like, subscribe for more updates on these and other innovations. And share with anyone at risk because every month counts. Early detection could be everything.